So, and the definition, does everybody know the definition of aspiration? That's when food, liquid, secretions, or gastric material passes below the level of the vocal cords. So this cuff doesn't prevent aspiration, right? Because anything that reaches that cuff is already aspirated. And material can still pass around the cuff and into the lungs because this isn't a tight seal against the tracheal wall. Okay, and anything that lands on top of that cuff can also be contaminated with bacteria, and the patient can't clear that material. They can't cough effectively to remove it. It can't be suctioned tracheally or orally.
Do we breathe at the same time we swallow? No. We close those vocal cords and we stop breathing. And we stop breathing during exhalation. Right before we start to exhale, we stop breathing. And when we close those vocal cords and that air stops, pressure builds in the airway. And it's important to think that our swallow is not only a mechanical system where one door closes, another door closes to protect the airway, but there's pressure behind the system too. As this system closes and we have positive pressure in the airway, guess what happens to that esophagus? Normally it's closed. Well, it opens during the swallow. It's a muscle that stays closed, but when we swallow, it opens. And so there's negative pressure in that tube. Well, where does anything go if it's traveling? Does it go to the area of positive pressure? No. It's going to go to an area of negative pressure. It's always going to go that direction. So that's what should happen during a normal swallow.
On the servo-i, if you're a facility that likes to use the PRVC mode or pressure regulated volume control, it works quite nicely with a Passy Muir valve in line. I have my ventilator in PRVC, my tidal volume is 750, my rate is 15, I have my PEEP set on 4, 21%, my inspiratory time is set at 1 second, and for purposes of the rubber lung, I have my trigger sensitivity on 5 so that this ventilator should not auto-cycle. Now my graphics are all intact. PRVC in this ventilator can be used quite nicely with the valve because this ventilator is monitoring the inspired volumes and not the expired volumes. So it will change your pressure levels automatically while reading the inspired volume. It does not look at exhaled volume. And my patient is ventilating quite nicely in the PRVC mode on the servo-i ventilator.